Hey guys, so what I want to talk about today is a subject that I always get asked about, and that's cannabis and sleep. You know, a lot of people just don't sleep well these days, and they need something to help them sleep at night. And a lot of people have found cannabis to be really helpful. So let's go over how cannabis can be helpful for sleep. And first of all, you know, what you should know is that there's two different cannabinoids in cannabis that can help with sleep. Some will argue that there's other cannabinoids as well, and I would be one of those people, but unfortunately, the only ones that are really commercially available are CBD and THC. So, for today's discussion, we're gonna restrict our discussion just to those two cannabinoids, but CBN is another cannabinoid that a lot of people have found to be really effective for sleep. And again, there's others, but we're just gonna stick to CBD and THC today. So cannabis and sleep. One of the big things that we need to know about cannabis and sleep is that you can develop a tolerance to THC. Okay, so there is a tolerance that you can develop to THC. But the good news is that it doesn't seem like there's any tolerance that you can develop to CBD. So CBD, again, has no tolerance. So, that's something that's really important to note because, we do need to acknowledge that THC does have some tolerance to it. If you do use a lot of THC, over time, you'll find that you'll need to use a little bit more to get the same effect. So now that we know that, let's talk about CBD and we'll talk about THC specifically. So first, we'll just start off with CBD. That's the easy one. Okay, so CBD. A lot of people do find that CBD can actually be helpful for sleep. It's not everybody, but some people do find that, CBD on its own can be helpful. But, if you are looking to use just CBD to help you sleep, what you need to know is that there's going to be other terpenes that are in CBD that are going to affect how that CBD affects you. So if you want to pick out a CBD for sleep, you're going to want to pick out a CBD that's high in myrcene. So myrcene is a terpene that's known to have very, very sedative properties. So, this is why a lot of people who say that when they use a lot of heavy Kush strains, not all of them, but a lot of the Kush strains do tend to be high in myrcene. And because they're high in myrcene, a lot of people do really well with that. So again, most people who use cannabis to sleep do use a little bit of THC. Some people, though, can sleep really well with CBD, and generally, the people who sleep well with CBD, they get products that are high in myrcene. Because if you get a product, say, high in something like pinene, that might actually give you energy and it might keep you up at night. So that's kind of CBD in a nutshell. Of course, there's a longer discussion to that, but in a nutshell, that's kind of how you pick out CBD. And, like I said too, there's no tolerance to CBD. So, people who find CBD to be effective for sleep, 2 or 3 years ago, they're using the same dose now. They've never needed to change that dose because, again, there's no tolerance. So let's talk a little bit now about THC and how THC can affect you when you're sleeping. So a lot of people have found THC to be very effective for sleep. They feel that it helps them fall asleep and they feel that it helps them stay asleep. So, just to quickly chat on that, if you're having trouble falling asleep, a vaporizer is going to be your best option. And the reason why is because it acts fast, right? So within about 1 minute to 3 minutes, 5 minutes maximum, you're going to feel a lot of the effects of the THC, and that's going to help you fall asleep. Now, what about if you're trying to stay asleep? If you're trying to stay asleep, an oil or an edible is going to be better. And the reason is because they stay in your system longer. Okay, so we're talking about 6 to 8 hours. Okay, so about 6 to 8 hours is how long the oils, the edibles will stay in your system roughly. Whereas the vape, it's going to be about 1 to 3 hours. So, very fast onset of action, but again, it comes out of your body really, really quickly. So, what a lot of people find to be effective is that they'll vape to fall asleep, and then we'll use the oil to stay asleep. And then that way too, you know, if you forget to take your oil till right before you go to bed, you know, no big deal, because as soon as the vape wears off, the oil is going to kick in, and then you're going to be ready to sleep. So, you know, that's just a little bit about THC and, you know, how to use vaporizer and how to use the oil or an edible to fall asleep and to stay asleep. Now, let's talk maybe a little bit about the THC tolerance, okay? So, you know, a lot of people don't like to admit that, you know, when you're using THC, you can develop a bit of a tolerance to it. But, you know, the fact of the matter is that, you know, THC is a medicine that you can develop a tolerance to. So, you know, let's not brush over that, and let's chat about it and figure out what we can do about it instead. So, you know, we know again that THC is effective for sleep, but we want to use it in the most effective way. You know, one thing I'll say, you know, right off the bat, you know, the more THC you use, you know, likely, yes, the better you'll sleep, but also too, likely, the more you'll have that hangover or groggy feeling in the morning. So again, you know, what I want everyone to know is that this is completely dose dependent, right? So meaning that the more THC you use, you know, the more of a tolerance you're going to develop. Also too, you know, probably the better you'll sleep, but again, in the morning, you'll feel more of that grogginess effect. You know, I don't have any, you know, PubMed references to acknowledge this, but, you know, I do have a very, very good colleague and friend, Dr. Caroline McCallum, and, you know, she kind of finds that a lot of people, their sweet spot with THC is about 30 milligrams a day. So meaning that, you know, try to not to use any more than about 30 milligrams a day if you can. You know, you might be putting yourself at higher risk of developing a tolerance to THC if you go beyond 30 milligrams a day. So, you know, again, I would try to, you know, stay within that type of range. You know, if you're someone who has chronic pain and PTSD and you have this excellent, you know, regimen that works for you when you're using beyond, you know, 30 milligrams, you know, absolutely no big deal. Go ahead and do that. But, you know, for most people, I would try to stay more to the 30 milligrams per day recommendation. So what happens to if you do develop a little bit of a tolerance to THC? You know, there's a couple different things that you can do. One thing that works really, really well for, you know, a lot of my patients is, you know, what they'll do is that they'll go back and forth between the flower and the oil. So again, you know, some people, like I said, they use the vape to fall asleep and they use the oil to stay asleep, and that works well for them. But, you know, for other people, you know, what they do is that they go back and forth. So they'll say they'll use flower for a month, right? For 1 month. And then they'll use oils for a month. And then they'll kind of go back and forth. And they find this to be really effective. So that's another thing you can do. You know, a last thing that I'll also mention, you know, to decrease your overall tolerance to THC is that you may have to go through, you know, a little bit of a withdrawal period, right? So you're just going to have to, you know, in some ways, I'm not saying suck it up, but, you know, you are going to have to possibly experience some, you know, difficult effects. So you may have a withdrawal period with THC if you're trying to get off of it when you're going to sleep. What I would do during that period is I would add melatonin. And you can go all the way up to 10 milligrams if you need to. Okay? So guys, that's just, you know, a little bit about THC and CBD and how they affect us when we're trying to sleep, and some different strategies you can use to make sure that, you know, you don't develop too much of a THC tolerance. If you have any questions or comments or different strategies that you use that I didn't discuss today, you know, please go ahead and let me know in the comments section. And as always, guys, I'll be back again soon.